see about DT based classes about special test. First, empathy. Empathy, my condition is dysfunction of sacroiliac joint. For this, ideate is flexion. The ideate for this condition is standing flexion test. The protocol is defined. Standing flexion test is done by when patient should be in standing position. The feet should be apart. We should keep on the PSIS, posterior superior iliac spine. We should ask the patient to flex forward. Flex பண்ணுங்க கொஞ்சம் முன்னாடி முன்னாடி flex பண்ணு bend பண்ணு முன்னாடி bend பண்ணு இப்படி bend பண்ணு. We should keep the hand on the PS and ask the patient to flex the trunk forward. இன்னும் trunk பண்ணு எவ்வளவு முடியுமோ அவ்வளவு trunk flex பண்ணு இன்னும் flex பண்ணு we should see our thumb equal. If it is equal, it is negative. If the thumb is upward and downward, the test is positive for standing flexion test. The protocol for this condition are low back exercise and tense. If the pain is overall, we should give the IFT. If it is specific, we can give the ultrasound. Next, result in result, we can give bridging exercise and pronal elbow. We should ask the patient to lie on supine and crook lying and ask the patient to lift off their. This is called bridging. Then prone on elbow. Ask the patient to lie on prone. Then ask the patient to lift off in the elbow. These two exercises we can give for this condition. Thank you.
Good morning. Today I am going to tell about the special test for lumbar spine, empathiize. It's used to test the spondylolisthesis condition. Ideate. I should use it to test this condition with the stroke standing test. Now we can go to see the prototype. Now I am going to tell that define. The patient should standing position. The patient should be standing. Then here the patient should stand on one leg. Then the patient should bend forward, bend extend. Then we have to he will balancing. Then we have to exchange the leg. We should see on bilateral. Then we have to note the pain in the low back. Then if the pain in the low back, they have the test should be positive. If this condition, the anterior displacement should be give the flexion exercise. If the condition has the posterior displacement, we can give the extension exercises. Now we can see the result. We have to give the pain. If they have the more pain, we can give IFT and tense, and we can give some exercises. Thank you.
I am going to say about how to find the rectus femoris tightness. So for this we can use to diagnose this. Now I am going to identify the rectus femoris tightness. So empathiize to rectus femoris tightness. So ideate, we can for this we can use LX test. Define makes the patient to prone. The affected side limb hip should be stabilized, and then another hand should be make the knee flexion passively. By doing this, the patient can't touch the hip bone, gluteus. By this, the positive is rectus femoris is, can be fine. So for this, we can give stretching exercise by quadricep muscles. And for the pain, we can give hot packs. By doing this, the result will be better.
Good morning. I am going to tell about the hamstring tightness. My empathize is the tightness of the identification of the tightness of the hamstring muscle, and the ideate I am going to test the 90 to 90 degree hamstring test. Define the patient should be in supine lying, and the hip and knee joint should be at 90 degree, and we want to tell the patient to extend the knee passively, and the patient can't do the extension while the pain is positive. So we can prototype for this hamstring weakness is we can give stretching exercise like 90 degree flexion of hip joint and knee joint, and we can give the hot pack. Result the positive sign is the pain is there, the test is positive. Thank you.